Paraneoplastic encephalomyelitis involves inflammation of the brain and spinal cord due to autoantibodies. It is caused by antibodies against two antigens in neurons, especially in patients with small cell lung cancer. Symptoms can include seizures, memory loss, mood changes, and motor deficits. Lambert Eaton myasthenic syndrome, LEMS, is another paraneoplastic syndrome. It is caused by antibodies against presynaptic PQ-type calcium channels at the neuromuscular junction. This reduces acetylcholine release, causes muscle weakness, especially in proximal limbs, which improves with use. Commonly associated with small cell lung cancer. USMLE Style Question 1. A 62-year-old man with a 50-pack year smoking history presents with confusion, short-term memory loss, and seizures. Brain MRI shows no mass lesion. A lumbar puncture is performed, and anti-Hu antibodies are detected in the CSF. What is the most likely underlying cause? A. Alzheimer's disease. B. Viral encephalitis. C. Paraneoplastic encephalomyelitis due to small cell lung cancer. D. Multiple sclerosis. E. Creutzfeldt-Jakob disease. Correct answer C. Paraneoplastic encephalomyelitis due to small cell lung cancer. Explanation: anti-Hu antibodies in a patient with neurologic decline and smoking history strongly suggest paraneoplastic encephalomyelitis due to small cell lung cancer. Why not the others? A. Alzheimer's. Gradual memory loss, no seizures or autoantibodies. B. Viral encephalitis, often shows brain lesions and inflammation on imaging. D. MS, demyelinating lesions and often relapsing remitting course. E. CJD, rapidly progressive dementia but not associated with anti-Hu antibodies. USMLE Style Question 2. A patient with known small cell lung cancer presents with progressive muscle weakness. Physical exam shows decreased reflexes and weakness in the legs that improves with repeated activity. What is the most likely pathophysiologic mechanism? A. Autoantibodies against acetylcholine receptors. B. Autoantibodies against muscle fiber membranes. C. Autoantibodies against postsynaptic potassium channels. D. Autoantibodies against presynaptic calcium channels. E. Destruction of anterior horn cells. Correct answer D. Autoantibodies against presynaptic calcium channels. Explanation: this is Lambert Eaton myasthenic syndrome caused by antibodies against PQ-type presynaptic calcium channels, reducing acetylcholine release. Why not the others? Acetylcholine receptor antibodies, seen in myasthenia gravis. B. Muscle membrane antibodies, seen in polymyositis or dermatomyositis. C. Potassium channels, related to neuromyotonia, not LEMS. E. Anterior horn cell destruction, seen in ALS and polio. USMLE, which of the following best distinguishes Lambert-Eaton myasthenic syndrome from myasthenia gravis? A. Worsening of symptoms with activity. B. Association with thymoma. C. Presence of anti-acetylcholine receptor antibodies. D. Reflexes are preserved in LEMS. E. Muscle strength improves with repeated use in LEMS. Correct answer E. Muscle strength improves with repeated use in LEMS. Explanation: repeated stimulation increases calcium influx at the neuromuscular junction, temporarily improving strength. Why not the others? A. Worsening with activity is typical of myasthenia gravis. B. Thymoma is associated with myasthenia gravis, not LEMS. C. Anti-ACR antibodies are in LEMS. Reflexes are reduced or absent in LEMS.